the Lyme, the Bartonella, the mold, the toxins, all of these things that you've discovered, if that is the primary cause of your fatigue, imagine someone trying to deal with the guilt with their responsibilities, or even trying to do some emotional healing during that phase when their cells are literally exhausted. I'm Dr. Aimie, your guide for transforming your trauma into your gift. You adapted to life experiences to survive, but you are not your trauma. Let's talk a little bit about this connection between the fatigue and the freeze response. Because I think that most people who struggle with fatigue don't recognize it as part of that freeze response in the survival system. And so recognizing that, I think, will just help them be able to understand and not be as frustrated with their body when it's not responding, and being able to perform at the level that they want to be and certainly know that they can be. So with the freeze response, what I have found is that the more of these variables that a person has, the more at risk they are of living in a chronic functional freeze state, or going back and forth between really super anxious in the sympathetic state and then the collapse of the freeze response where they just can't do it anymore. I think of like the hamster on a wheel, right? And people tend to go back and forth between running on that wheel as fast as they can, always feeling behind, always feeling anxious, and then they collapse exhausted until they have enough energy that they get right back on the wheel. And they just go back and forth between the sympathetic response and the freeze response. And they're always feeling tired because of that. And so that's like from my perspective, the reason for the adrenal fatigue, the reason for these other imbalances being developed in the body, in the biology, because of that nervous system being stuck in between high energy state and low energy state, and never going into that sweet middle zone of, hey, we can be calm, we can allow our body to do the healing and the restoration and the reparative, work that it needs to do when we are in a good place and we feel safe and secure. And so having this fatigue is that sign of, hey, like, we're either stuck in sympathetic or we've reached the point where we're going into overwhelm. And so for me, that's been an important word to start using for people. And I'd be curious to see if that word comes up a lot for you with your patients, with just that feeling of overwhelm. And this is what the biology looks like when it is in overwhelm. It looks like and feels like fatigue.
Yeah, I would definitely agree. It is very common for people to talk about their fatigue and their overwhelm. And a lot of this is because there's kind of a Goldilocks dose of all of these different things in the body, whether it's adrenals or thyroid, and whether it's, if it's too high or it's too low, you're going to get symptoms. And when you have chronic stress on the human organism that has ending up and damaging the mitochondria, and the mitochondria does more than just produce energy, it also helps these hormones get into the cells, or they're compromising the adrenal gland, so it's not able to produce cortisol. So if it's not able to produce cortisol to manage stress, then what it's going to do is it's going to dip into the adrenal medulla, which is like the central part, and it's going to pull out norepinephrine and epinephrine, which is basically adrenaline. So then you're relying on adrenaline, which always has a component of anxiety with it, in order to get your stuff done. So like when you're pushing through and you're experiencing that anxiety, it's because you don't have that normal get up and go with cortisol that you need because of these chronic stressors. And so I absolutely agree, that you're kind of fluctuating between this sympathetically stimulated where,
adrenaline driven.
Exactly, adrenaline driven, and then that collapse, that freeze response where, and then you recover, and then the body's like, okay, you can go again, and then you go. And this is one of the big reasons why there's a lot of people who are advocating a pacing treatment, which is very interesting to me, because I when I first heard about it, I was already practicing treating fatigue, and I was like, gosh, that's so interesting. Isn't that just common sense?
Right.
Like
Yeah.
pacing means, don't expel all of, if you've got a bowl with a bunch of energy balls in it, you're not going to just dump out all those balls on one thing and then you're cashed for the rest of the day. But
Right.
oftentimes we need reminding,
Hmm.
that we really have this energy budget and we can
Yep.
only use a little bit at a time. Otherwise, you're going to be wasted and you're not going to be able to cook dinner or play with the kids later on if you expel all of your energy budget during the day.
Yep. And similarly, if you are having these biological reasons for the fatigue, so it wasn't necessarily the emotional stress or the trauma that caused the fatigue, but you have these, the Lyme, the Bartonella, the mold, the toxins, all of these things that you've discovered. If that is the primary cause of your fatigue, imagine someone trying to deal with the guilt with their responsibilities, or even trying to do some emotional healing during that phase when their cells are literally exhausted and don't barely have enough energy to just get through the day. Very similar to you, when I was in my fatigue time of my life, it was about 2 hours of productive time a day, and that was it. And so I was also thinking at that time that I was, depressed, I was anxious, so maybe I should be in therapy, and yet I was not making any progress in therapy. And now that I understand, well, of course, like my cells were barely struggling to get through the day. There's no way that they had the energy to also do emotional work, or the nervous system needs that neuroplastic ability to make new pathways and form new ways of thinking, new ways of feeling. And if I don't have enough energy because I've got the toxins, I've got the compromises to my mitochondria, I'm in adrenal fatigue, there's not going to be the actual nutrients that the nervous system needs to do that pruning and gardening work that is required for change and healing and therapy. So many people, come to me and they say, well, I really want to do therapy, but I don't want to be in therapy long. Like I don't want to be in therapy for years. I know that I've got stuff to work on. So let me work on it and let me just, get through this as fast as possible. And I always bring them to this. I'm like, all right, well, then we've got to work with your mitochondria. We've got to work with your hormones. We've got to work with your adrenal glands. We have to make sure that there's no deficiencies and there's no toxicities. We've got to be working on all of this in order to maximize your cells and your nervous system cells specifically to be able to do the emotional work that does require energy. And so when we've got these factors, just knowing that our cells, our body will be more prone to overwhelm, we actually are at higher risk of experiencing life traumas because our biological capacity for stress is less. And I know that you see that so much in your work.
Yeah, and this is one of the reasons why step two is where it is, because step
Yep,
two is all about replacing deficiencies.
exactly.
And people will say, well, if this process is all about removing the toxicities in step four, why are we doing replacing
Right.
deficiencies in step two? Why can't we do like step four first?
Yep.
And it's because you have to boost up those
Yes.
deficiencies in order to get that boost of energy to then start to make those changes, to start to work on
Mhm.
the mental, emotional stuff. I don't actually talk about lifestyle habits
Mhm.
until about halfway through the deficiencies because you have to boost what I call the big three, the adrenals, the mitochondria, and the thyroid first in
Yes.
order to get the energy to actually change your diet or drink
Yep.
more water or be more
Yep.
organized or all that sort
Yep.
of stuff.
Yep. Absolutely. I agree with that 100% because otherwise people stay with their same patterns, which are basically coping mechanisms for life, right?
Hmm.
They maybe are driving on the way home, they have no energy. And so they're looking for what can I do this evening in order to, just get through my evening and have enough energy to do this all over again tomorrow. And it's, well, I'm going to stop by, I'm going to go through the drive-through in order to get food because I don't have the energy to cook.
Right.
I'm going to come home and I'm going to just sit on the couch and watch TV or watch movies and not actually interact with my spouse or my kids or walk my dog because I don't feel like I have the energy. And all of that just creates more accumulated stress, right? Because that's not how That's not how the body is actually happy and intended to live. It's intended to live in being fully present and being fully alive, fully engaged. And so when we're not, it's an inner conflict that only adds to the fatigue as well.